I'd like to call the Health and Human Services Committee meeting to order. Madam Clerk, can you please call the roll?
Alderwoman Green.
Present.
Alderman Gunther.
Here.
Alderwoman Martin. Alderwoman Middlebrook.
Present.
Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairwoman Ingrassia.
Present.
6 present, you have quorum.
Thank you, Madam Clerk. If you've had a chance to review the minutes from the May 19th, 2021 committee meeting, I would entertain a motion for approval.
So moved.
Second.
Madam Clerk, please call the roll.
Alderwoman Green.
Aye.
Alderman Gunther.
Aye.
Alderwoman Martin. Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Alderman Todd.
Aye.
Chairwoman Ingrassia.
Aye.
6 aye votes.
Thank you. We're going to skip over the board bill and take up resolution number 36, Alderwoman Middlebrook.
Thank you, Madam Chairwoman, members of the committee. Resolution 36 is an annual resolution that authorizes the budget for the St. Louis City Senior Fund. In 2016, the City of St. Louis voters approved a property tax for the purpose of providing programs, which will improve the health, nutrition, and quality of life of persons who are 60 years of age and older. The senior service tax generates approximately $2 million in revenue a year, and a portion of which is awarded to local nonprofits and government entities to help older adults age in the home and community that best serves their needs and interests. Approving this resolution will allow them to continue these needed services in our community. And today we have Jamie Opsel, the Executive Director of the fund, to give more details and insight into their budget.
Jamie, please proceed.
Thank you. Thank you very much for allowing me to come and present. I can either answer questions about the variance between the budget between the 2 fiscal years and the handout that I've sent, or I also have a PowerPoint presentation that kind of goes over, gives you a little bit more information about the types of things that we fund, because we are relatively very new. So it's your choice on which.
Sure. STL TV, are you able to allow Jamie to share her screen?
She should have the power already. You should see a green share screen button on the bottom of your taskbar.
Okay, I see it, and I'm looking for the presentation. Okay, so my apologies.
Take your time.
I will get it opened right away. Okay. And okay. So can you all see this?
Not yet.
Okay.
If it's being tricky, feel free to email it to me and I can share it, and just you can let me know when the slides need to.
Okay. I'm just not understanding why it's not here. Let me go to share, back to share screen. It's not allowing me to share the screen. Oh, there. Okay, can you see it now?
Yep, perfect.
Okay, great, thank you. When looking at the budget for fiscal year 22, and I'm trying to advance it, and it's not advancing. Okay, there we go. The largest variance that you will see in the budget between last year and this year actually is under our agency grants, our fund defined and applicant defined category. This is due to the fact that we are in the process of increasing our funding from which we average around $1.7 million in grants, but since the beginning of our existence, in the first 2 years, we actually were not able to get funds out as quickly as possible. Most of the funds actually came from the first year because the funds came in mostly in January and February, and the end of our fiscal year was June 30th, and our first grants went out July 1st. So we had most of our funding or our savings from the first year of being in existence. So what the board prudently did was they really wanted the funds out in the community, so they ramped up funding in the next few fiscal years to where we actually peaked this in the current fiscal year 21. And when we talk about the types of grants, and I'll go back to showing you, like I said, we average around $1.7 million, but we really ramped up last year, and it actually was to the benefit because, as you all know, older adults were greatly impacted during the pandemic. And so we were able to provide a lot of emergency funding and other types of support services out into the community. But now in this year, we're going to be starting that ramping down process to get us back to normal. When I talk about applicant or fund-defined grants, what I'm talking about mostly are grants that have been priorities that have been identified through a needs assessment process. And we have 7 main priority funding focus areas. One is fall prevention, economic security, where we do the National Council on Aging economic benefit assessment. We provide utility assistance, weatherization for heating and cooling supplies. We support older adults moving to senior subsidized apartments. In fact, in the first year, we had 29 homeless older adults moved into senior subsidized apartments. We support Legal Services of Eastern Missouri with legal services, and we have financial counseling programs. We also fund social isolation prevention programs. And again, this was actually something that was very important, especially during the pandemic, where we fund senior companion programs. We fund evidence-based program, social isolation program called the Circle of Friends. And actually it was the first time this particular evidence-based program was in the United States of America, was here in the city of St. Louis in senior subsidized apartments. We also do dementia care planning and training, and we offer hearing screenings and free hearing aids so that people are not socially isolated. We provide homemaker chore services. We really focus in on those people who don't qualify through Medicaid, or those that are in Medicaid but aren't getting enough services. They get additional programs to help them with activities of daily living and instrumental activities of daily living in their home. We fund meals through food outreach for people living with cancer and HIV/AIDS. And we also expanded this year into more exterior home maintenance programs with mowing, gutter cleaning to prevent code violations. Last year, we invested in oral health through AT Stills to provide free comprehensive dental treatment. And we also provide funding for a free bus pass or reduced bus pass program and other types of matching programs for senior centers to get additional METAP funding for vehicles for their centers. And then we also, so the big changes between the grants from last year and this year is that we really kind of transitioned from a fall prevention only focus to be more of a housing focus. We had some grants that really focused on home repairs and home modifications, and we just really expanded that focus to do more outside types of work as well. Most of the funding that we used to spend down the net position was with our applicant defined grants. And this is a recognition that sometimes older adult or agencies that serve older adults, they can identify something that maybe didn't come out in a needs assessment. And so we allow these agencies to have one-year grants where they tell us what they see the needs are in their community. And those can focus on all kinds of different types of needs. Again, we really focus on economic security and transportation because that does come up in our needs assessment as a top issue. But we also continue to focus on health and safety. And we actually are piloting the first evidence-based program called the Capable Project out of Johns Hopkins University, where you're putting together an occupational therapist, a nurse, and a home repair specialist. We also provided a lot of funding for food pantries and including funding for PPEs and so forth during the pandemic. What we found was a lot of older adults were having to wash their canned goods to get the salt out because the food is just so high in salt, and those were the only food sources that they had. They weren't able to access fresh fruits and vegetables. And then again, we continued with our one-year applicant-defined grants focused on social well-being. And one of our biggest surprises, and was just a great grant opportunity that we really like to support, was the Sankofa Art and Culture and Wellness Village. And here she was able to provide programming to older adults. She trained them. We provided funding for laptops and hotspots, and then the training. And then she was able to provide different art and culture classes and health and wellness classes to older adults on the north side. And so people that were homebound actually had an opportunity to be able to interact with other people. And in fact, they even had a New Year's Eve celebration. Again, we continue to support older adults who are dealing with hearing loss with free hearing aids and batteries and repairs. And we've also been able to fund new older adult clubs, although they've had to meet virtually during this time. And then the last focus area under applicant-defined grants is we funded several of our senior centers with one-year grants to help them so that when they do reopen and they're able to provide much needed resources. These organizations are small not-for-profits who've been underfunded for many, many years. And so with this funding, they were able to provide more freezers and refrigerators so that they could house the increase in requests for home delivered meals. They were able to purchase commercial ovens, get computers and hotspots for their own staff, and then even did some building improvements such as tuck pointing, and we were able to provide some short-term operating support as well. And then in the budget, what has really stayed the same for this next fiscal year is our collaborative and emergency funding. And we're very excited because since we are housed with the Mental Health Board, we were able to collaborate with them on a grant, including not only us and the Mental Health Board, but the Community Foundation, in providing older adults in the St. Louis City nursing homes who had not been able to leave their home for over a year. Now we have mental health specialists going in and providing services as we speak. And then last but not least, like I said, we did provide, had funding set aside, and will continue to have funding set aside in the next fiscal year for emergency funding. And this again supports things like social distance signage, plexiglass shields, PPEs, thermometers, cleaning supplies. Most of this funding did go to home delivered meals because the St. Louis Area Agency on Aging had lost significant funding through the new state funding formula for area agencies on aging. And we were able to help go in and provide $100,000 to go for, to help to try to offset some of their losses. We invested in technology to connect older adults for telehealth services and for senior center virtual programming with technology through tablets and hotspots and smartphones. And then we continued to provide utility assistance and other emergency financial assistance. What we found during the pandemic is that older adults were not able to qualify for some of the funding because for rent assistance or mortgage assistance, because to qualify, they would have had to have lost a job, and they didn't lose a job. They just don't have enough money to live on. And so they weren't eligible for some of those resources. So just basically to give you a summary of the residents that we've served in just this fiscal year in the first 6 months, with that increase in spending, we're almost at 1,969 older residents were served in the program. The median age was 70 years. 50% of the residents that we served had an annual income of $11,562 or less. 68% of the older residents served were women, which is not unusual, and 73% of the older residents served were Black. And here you can see where residents served that pretty much we've served almost the whole entire, well, we haven't served the whole entire city, but you will notice that the zip codes that have the darkest blue is where we've served at least 100 plus residents. Then the lighter shade of blue is 50 to 99 residents served. The darker green is 10 to 49, and then the light green is less than 10 older adults served in that area. And what's unique about this is that in zip codes 63113, 107, 115, 108, 147, and 112 are the zip codes with some of the highest percentages of older adults. And 63116 has some of the highest number of older adults in the city. It accounts for 13% of the city's 60 plus population. And then 63118 and 63116 has the highest percentage of older adults and refugees served by organizations that we support, such as St. Francis Community Services and BIAS. And that is it.
Excellent. Thank you so much. Really appreciate you taking the time to go over it. I'll start with Alderwoman Green. Do you have any questions for the sponsor or Jamie?
I think the only question I have, could we also bring back up the budget that I think you showed earlier, just to see a little bit of the breakdown across all these different areas and how much is going into what different area?
So basically, let's see, let me pull that up again.
Or maybe I was looking at it in the Google Drive.
I just presented the grants section,
okay,
which is the main variance, but let me go back and, oh, great, thank you.
Yeah, I'm trying to expand it. Hang on. Let me try this again.
it's okay. I found it back in the Google Drive.
Okay, yeah, the toolbar is over the place where it would allow me to expand. Here we go. Okay.
Okay. I'm happy to answer any questions you have about the budget.
A little bit. So you're covering a lot of different things, it seems like. So how are you making determinations, when giving out these agency grants about, where is the highest need in order to allocate these funds through that grant process?
That's a great question. So in the very beginning, year one of our coming into being, we actually sent out surveys to older adult residents all throughout the city, and had made sure that we had, representation from every part of the city. We had over 436 people respond, and provided us with information on what they felt were the most important issues or needs in order to age in community. In addition to that, we also had focus groups, both in North and South St. Louis, and obtained additional information from people through there. And then the third piece was we did a provider survey, where we sent out an electronic survey to senior service providers to find out what the needs were, the waiting list were. And then we had an evaluation specialist come in and take all of the data and help to walk the board through and prioritize the needs. We looked for reoccurring themes, and that's what we prioritized the funds on. And those 7 priority areas were the top 7. But you're right, Councilwoman Green, the fund is small and the needs are great.
That brings me to another question. So with the kind of the shift to housing and some of the home repair funds, because I know I hear about that a lot from a number of seniors in the 15th Ward, are you coordinating with the CDA funds and HUD funds, and how is that process working to make sure that there's not overlap and we're hitting different people or different populations, or are those funds being streamlined in some ways?
I will say that when you have all these different funds, they can be very siloed. However, we do fund a few organizations like Mission St. Louis, who also receives those funding, and they have been able to plug in our funds where those other funds are not able to provide services. So we are just new in this. We're open to suggestions on how we can improve, and would love to get your input on ways that we can improve. Because what we do find is that each funding organization can become very siloed.
Yeah, and I guess this is more along that note, feedback more so than question, but one of the things that I've heard from constituents is that they make a little bit too much money to qualify for the current home repair programs. But they are still poor and on a fixed income and cannot afford, the $10,000 roof repair or whatever. And I think, one of the things we need to look at is some of those income guidelines, because it sometimes seems like a too low of a bar that people have to meet in order to qualify when there's still some pretty big need there.
I'm glad that you brought that up, because that actually is how Mission St. Louis has been able to use our funding, is for those who don't qualify for other resources. And so, and not only with our housing, but we do that with, like I said, our homemaker chore when people don't qualify for Medicaid, but they're still very low income. And so we allow agencies to plug our funding in where there's holes in other federal or other local funding sources, so that we know that we are in fact meeting an unmet need. Okay. We are also looking at bringing together the organizations who do home repairs and to looking at how to support a network again. There used to be a home repair network, and we're looking with our other funding partners to see if we can't try to resurrect that network for some more coordination amongst the agencies.
Okay, that's great. Thank you. No further questions.
Alderman Gunther?
Thank you, Chairwoman. I don't really have any questions. Mine were similar to the housing questions that Alderwoman Green asked. So no more questions. Thank you.
Alderwoman Middlebrook? Oh, but this is your resolution. Never mind. Alderwoman Rice?
I don't think I have any questions. I just really appreciate all of the work that the senior fund does, and your really great presentation. It was very thorough and really helps us understand what it is that you're doing and who all is benefiting from your services. So thank you so much for that.
Thank you.
Alderman Todd.
Thank you. I don't have any questions. Thank you, madam.
Okay, Jamie, thank you so much. You're always such a good steward of the taxpayer dollars that are coming into this fund. And I know from being on the regional response team meetings with you lately that you've been such a zealous advocate for senior citizens and helping shepherd them through the pandemic. So I really appreciate all your efforts and the efforts of the fund. Alderwoman Middlebrook, would you like to close?
Yes, I would just like to ask for your favorable consideration in passing out resolution 36. Thank you.
I will entertain a motion to pass resolution 36 out with a due pass recommendation.
So moved.
So moved.
Second.
Second.
Previous roll.
Hearing no objection to previous roll, resolution 36 comes out with a due pass recommendation. Is Dr. Eccles still on?
Chairwoman Ingrassia, he was on and called away and asked if it would be possible for me to continue on with what you started, I believe, last time.
Yeah, absolutely. Thank you, Craig. So the next item up that we have is Board Bill 30. Alderwoman Middlebrook, would you take over the meeting for me, please?
Absolutely. Thank you. So we are now doing Board Bill 30, sponsored by Alderwoman Christine Ingrassia. Would you proceed?
Thank you, Madam Chair. If it's okay with you, I would like to put Board Bill 30 committee substitute before you. You should have received a copy a couple of days ago from the clerk.
Absolutely.
Okay. Craig, will you just kind of go over some of the changes? I think these are mostly, again, like the two previous board bills that we had, kind of housekeeping things and nothing of a real substance.
Right. So the city council.
Oh, you muted yourself.
Sorry about that.
No,
Stay on the straight and narrow and make sure that we have the language that specifically talks about appropriation, and that, of course, that it has been approved by the Board of Estimate and Apportionment, trying to make sure that we had the right reference to dollar amounts. And so they were some legal housekeeping, as the chairwoman indicated.
Oh, I don't have anything else, and happy to answer questions, or I'm sure Craig is too.
Yes.
Oh, Alderwoman Middlebrook, you're muted.
Thank you very much. Okay, so we'll start with committee members for questions. Alderwoman Green.
No questions. Thank you.
Thank you. Alderman Gunther.
No questions. Thank you.
Alderwoman Martin. Okay, Alderwoman Rice.
No questions. Thank you.
And Alderman Todd.
No question. Thank you.
Okay, thank you. And I have no questions, so I will go ahead and entertain a motion to accept Board Bill 30 committee substitute.
So moved.
Second.
Thank you.
Previous roll.
Hearing no objections to previous roll, we are good. Thank you. Alderwoman Ingrassia.
Thank you, Madam Chair. Just one last housekeeping piece. Well, two things. Does anyone have any announcements? Want to make sure that we excuse Alderwoman Martin for necessary absence. And then just a quick note that because 3 out of the 3 bills that I've presented so far from the Health Department have had housekeeping changes, I worked with the Health Department and the City Councilor's Office to make sure when board bills come before us that the City Councilor's Office has a chance to review those before they get introduced. So with that, I will entertain a motion to adjourn.
I move to adjourn.
Second.
Second.
All right, thanks everybody. See you next time.